Hello and welcome to all the audience who has joined this program. Welcome to the Bear for Health podcast, where we talk about health, wellness, and everything in between. I'm your host Parikshit Chindade, and today we are going to talk about a topic that doesn't get much attention: kidneys and blood pressure, the silent connection. To help us navigate this topic, we have Dr. Tapaprata Das, consultant nephrologist from Kolkata. Welcome to the show, Dr. Das, and it's a pleasure to meeting you. So, Dr. Das will be sharing his insights into kidney disease prevention, risk factors, and other preventive measures. Welcome to the show. So, let's start with our discussion first, sir.
Thank
So, doctor, what do our kidneys have to do with blood pressure? Because we all understand that kidneys are filtering organs, but the connection with blood pressure is not known. So, can you please throw some light on the what our kidneys have to do with blood pressure?
Mainly the blood pressure, what we know, is mainly regulated by fluid and salt. And what the kidney does is mainly maintains this balance of fluid and salt retention. If the kidney doesn't work quite well, then what happens is there is a large amount of fluid and salt retention, which causes this hypertension, which is the initial part of the development of hypertension. And then it is followed up by the complications of hypertension. But initially, what we all should know that what kidney does is handling the total amount of volume that is in the body and the total amount of salt that is in the body. And maintaining that balance maintains the BP.
So thank you for that insight, sir. I think that brings me to my second question, which is essentially a follow-up question. So we all hear that blood pressure is one of the biggest risk factors for kidney disease. So why is that, sir? Why is blood pressure such a big risk factor for kidney disease?
Now we all know that the patients we get usually have these two big risk factors. One is having this hypertension, that is high blood pressure, and that is mellitus. Uh, as we are talking only about BP today, so I'll say that in long term, this high blood pressure causes intraglomerular hypertension. In layman term, in the kidneys, the glomeruli are small vessels. These get constricted over time with the exposure to very high pressure inside the body. It is a mechanism by which kidney tries to protect itself, but in long term, it causes renal damage. Hence, this long-term exposure of hypertension causes progressive kidney damage, and hence this early detection of hypertension and treatment, optimum treatment of hypertension is goes a long way in the prognosis of the patient and keeping the patient healthy in long term.
So, doctor, thank you for that valuable insight. So my next question is again a follow-up question to the earlier question. Doctor, can kidney disease actually cause high blood pressure also?
Yes, uh, this is what we call secondary hypertension. Uh, what we usually see in the population normally is primary hypertension, which is the essential hypertension, and secondary hypertension. One of the most important causes kidney disease is the most common cause of secondary hypertension, and hence, whenever we get a young adult or an adult with no prior comorbidities with hypertension, we always check for a creatinine, and if the patient is passing protein in the urine. Hence, it is one of the very important cause of hypertension. And damaged kidneys also releases some hormones, which again increases the chance of hypertension. Hence, it goes a long way in development of hypertension. This renal parenchymal disease is one of the most important cause of hypertension, as well as renal vascular diseases like renal artery stenosis.
So, sir, you have talked about the disease and the connection between hypertension and kidney disease. And we all know that kidney disease as well as blood pressure, these are known as silent diseases. So, as far as the
Yes.
early warning signs are concerned, in your opinion, sir, what are some of the early signs that people should look out to kind of say that they have a kidney disease or, they are suffering from elevated blood pressure?
Some of the very early signs that some patient experiences, but they usually don't much of an importance to it is sometimes they have some dizziness, some headache, some very low level of edema, that is swelling of the ankles or swelling around the eyes, some amount of unexplained fatigue. Sometimes this fatigue comes from the initial part of the renal dysfunction or this hypertension. And last but not the least, this foamy urine, passage of protein in urine, which comes due to this prolonged hypertension, which is there, which was left undetected. So, and sometimes due to hypertension, some patient might feel shortness of breath due to development of some cardiovascular disease. Hence, all these small things should be kept in mind, and the patient should regularly check their blood pressure if they are feeling any one of these symptoms which I mentioned.
Right, sir. Right. So, sir, that brings me to my next question, which is the management of kidney disease and blood pressure. So, sir, in your opinion, what are the best ways to manage blood pressure and protect kidney health?
Now, without going too deep into the guidelines, what the recent guidelines have stated that the first line medications that should be started in a patient who has been newly detected with the hypertension is ACE inhibitor or ARB. Second line is always a calcium channel blocker. And then after giving the optimum doses of both these two medications, if the BP is not well controlled, then we should give the third line drug, that is the diuretics, and then come to all the fourth and fifth line drugs. There is an array of medications which can be given, but initial medications are these three medications which I have stated.
Right. So, sir, as you will also agree that medications are really wonderful and they do help the patients. But what is it that the patient should essentially do to, help manage blood pressure and kidney disease from the standpoint of lifestyle modification?
Now, we all know that hypertension and diabetes, both of these are lifestyle diseases. Only taking medication doesn't help the patient. It should be a holistic approach. Uh, Diet is a very important part in that approach. Because it's a lifestyle disease, uh, as a whole, the lifestyle of the patient should be moderated again. A diet should be followed, which should be the diet should be rich in fruits, vegetables, and lean protein, without too much of fat with the protein. And 150 minutes of walking per week, that is 30 minutes, 5 days a week at least. That is also mentioned in the ADA guidelines, the recent ADA guidelines. Hydration again is the key, because if the patient is dehydrated, again, there are multiple mechanisms of the body which causes kidney damage. Hence, hydration is the key, plenty of water intake, a good balanced diet, and more of water, less of junk food, less of salt. It goes a long way in initiation of treatment and also maintenance of a very good blood pressure. It goes a
Right.
long.
I think very, very nicely described, sir. So we are at the end of our conversation almost. So before we wrap up, sir, may I just request you to give some important take-home messages to our audience from the standpoint of protection of kidney as well as management of blood pressure.
Usually in our practice, what we see, there is a very big loophole, a very big void in case of screening the patients. Patients come with major organ damage. What in our what should be our goal? This was our main theme of the World Kidney Disease, that there should be early detection of kidney disease. And early detection of kidney disease can only be done with early detection of hypertension, early detection of diabetes. Hence, early detection can be done if there is regular screening, regular blood pressure checking, making small consistent lifestyle changes. And if there is some symptoms, don't wait for somebody to tell you, get yourself checked, get your reports done, check your BP, check your sugars, and then consult a specialist and initiate the treatment as soon as possible.
Right. Very, very nicely summarized, sir. And we are almost at the end of our podcast. So the message for the audience is that kidney disease and blood pressure do go hand in hand. And with regular lifestyle modification, you can certainly prevent the damage of kidney as well as development of hypertension. So whatever advices that Dr. Das has given us, if we are able to follow them, certainly we can delay the onset of kidney disease. So thank you, Dr. Das, for the excellent insights. And to all the audience who is watching this program, to get more health updates on this topic, please like, share, subscribe Bear for Health India on Facebook, Instagram, and YouTube.